Ray Hovsepian is president of Omni Dental Studio. They've been a family-owned and operated business since 2008. Let's meet Ray Hovsepian. Hello, Ray.
Hi, Tim.
And thanks for coming in.
Good to see you.
Please sit down. So tell me, how did Omni Dental Studio get started?
Well, it all got started when I graduated from Pasadena City College Technology Program. And I've always wanted to be in this field where we make prosthesis and crowns and bridges for patients. And I was pretty good with my hands, and after thinking about different careers, I decided to go into this. I thought it was a pretty noble career to go into.
Absolutely.
And so after working for a couple of reputable laboratories, I got enough experience and decided to go on my own.
So your clients would be dentists, would that
Yes,
be?
we don't deal with the public itself. We deal directly with dentists. We have local dentists. We have dentists that send us work all the way from Connecticut and the New York area as well.
Oh, that's right. So they don't really need to be next door. They're going to send you the molds or whatever it is.
Right.
Yeah, and then they could be anywhere.
Yeah, if you've ever gone to a dentist's office, you need to get a crown. What they do is they prepare the tooth and they take what's called an impression of your mouth.
Yeah.
So they send us that impression with a prescription, and depending on what type of restoration they want, and we take it from there, basically.
Well, so what other, tell me all the things. I know it's crowns. What are some of the other things that you find yourself making?
Well, what we specialize in is what's called fixed restorations. What I mean fixed restorations is anything that is cemented into the mouth, it's not removable. For, say, partials or dentures where it goes in and out of the patient's mouth, we don't deal with anything that's removable. Everything fixed, which could be your basic crowns. It could be veneers. We do beautiful smile line cases for anterior teeth. If patients have diastemas and stuff like that, that's what we specialize in, as well as your implant crowns, which are very popular now these days.
I was going to ask that. They do seem to be, from the advertising, very popular. Are you a big proponent, I'm
yes,
sure, of that technology?
Yes, I strongly stand behind that. And I do because it's something that is permanently placed into the patient's mouth, and it's not removable where it could fall out or get loose in the patient's mouth, and aesthetically looks really natural and it feels good as well. And as long as you have a good laboratory that could provide you with that final product, you'd be very happy with it.
Now, how have things changed since 2008? So probably more implants, or are there other ways?
I think what the industry is changing day by day. We work with a lot of CAD/CAM systems now, where it's tend to go away from the metal restoration. So we're doing a lot of metal-free stuff, all porcelain, all ceramics, all zirconia crowns are very popular now. And we are certified, and we deal with all aspects of that as well.
What do you do differently from your competition? Every company has their own niche.
Yes.
There's something different. What do you do?
Well, I think what I take pride, like I said, we're a family-run laboratory, and I want to thank you for letting me introduce my laboratory and tell us what we differ from it. We don't outsource any of our work. Everything is made right here in Burbank. We don't believe in any of that offshore stuff, sending stuff out of the country. So everything is done by skilled technicians that are certified, that know exactly what needs to be done according to all ADA and OSHA regulations, which is very important now. So I think that's something, and we're not part of any big corporation or anything like that. So it's all our clients we deal with like family.
Well, what kind of clients are you looking for now? I mean, it's not the general public. It's you're going after dentists, I would assume, and hoping.
Well, like I said, our doors are open to all general dentists. Is what we work with primarily, and what we do is basically we take the client, we talk to them, we sit down, and find out first and foremost what are they looking for, what type of laboratory are they looking for, which is very important. And what are some things that they lack It could be a communication there. It could be lack of the product knowledge of what is out there right now. Like I said, industry is changing almost every other month. They got new products out there, better, trial stuff. So it's very important that we have a good communication with a doctor where we can explain exactly what would be the best fit for that patient and to make sure they get the best that they can. So that's basically what we like to do.
Well, I'm pretty confident that I have some of your product in my mouth right now, and it's doing well for me. So thank you very much, Ray, from Omni Dental Studio. You do great work, and much success for the future.
Thank you very much, sir.
Thank you, Ray.